A Friday morning, this is one of the first tweets that came across my Twitter page, and it was from Dr. Tedros with the World Health Organization. And he said, sad to confirm that two people who traveled from Beni to Mwanga in South Kivu, it's a different province, in the DRC are infected with Ebola. Now, this has sparked a rapid response by the Ministry of Health in the DRC, the World Health Organization, and other partners to provide treatment, identify all contacts, raise community awareness, and begin vaccinating. So this makes it the third province in the DRC to have Ebola cases now. Ituro province, North Kivu, and now South Kivu. So that was the shocker on Friday morning. And moments after that, the World Health Organization put out their own tweet concerning it, and we find out that it was a mother and her child that had been confirmed with Ebola in South Kivu. These are the first cases in this province. As soon as the alert was raised last night, response teams were on the ground ready to provide treatment, start tracing contacts, and begin vaccination. And then there's this report out of DRC media, and it's entitled, Ebola in South Kivu, the governor hails the vigilance of the response teams and reassures neighboring countries. In a message to the people of his jurisdiction after the confirmation of the Ebola virus cases in Mwenga territory, hope I'm saying that right, the governor of South Kivu province, Theo Kasi, salutes the vigilance of the response teams committed to this territory that have rapidly detected and isolated the cases. On Friday, Theo Mungwanbija Kasi, sorry, I'm probably butchering that name also, chaired a meeting with the public health experts to discuss steps they will need to take to strengthen surveillance at entry and exit points to prevent further spread. He announced that national coordination teams are already deployed in the region. And he also said that the vaccination of has already started for already listed contacts. At the moment, quote, all contacts are being listed for daily monitoring. This is the vaccine, and we are happy to have it here. And I urge people to trust the political administrative authorities who have made all the necessary arrangements. So that's the governor of South Kivu province from a DRC media source. And just to give a little update on the case counts that are going on in DRC, this is from the Ebola dashboard and from the World Health Organization and the DRC ministry. We got right here 2,868 confirmed cases, confirmed and probable, and right here in the bottom right hand corner, 1,921 fatalities. That's what we've seen so far there. So that's some big news that's happened in the past week concerning Ebola. The other big news was this news about the Ebola drugs and how these two drugs kind of stood out and are going to be the only ones with any future work done on them. And this is from the World Health Organization. It says, the co-sponsors of the Ebola therapeutics trial in the DRC have announced advances that will bring patients a better chance of survival. 2 out of the 4 drugs being tested are more effective in treating Ebola. Moving forward, these are the only drugs that future patients will be treated with. And there's a lot more details in this WHO press release and also in a NIAID press release put out elsewhere. But let's take a look at this CIDRAP report where they're talking about this exact situation, and it's a little clearer on how they wrote it. So I want to go over that. It said global health officials today, which was earlier in the week, announced a pause in the clinical trial of 4 investigational Ebola drugs in the DRC outbreak region after an early look at the data found that 2 of the drugs, Regeneron and MAB-114, stood out as more effective. An independent monitoring board meets periodically to review safety and efficacy data, and at their August 9th review recommended that the study be stopped and all future patients be randomized to receive either Regeneron, an antibody cocktail, or MAB-114, an antibody treatment developed from human survivor of the virus. Now, the 2 other drugs involved in the original trial were ZMapp. We heard a lot about that during the 2014 to 2016 West Africa outbreak. However, in an earlier trial, it didn't show statistically significant efficacy, but performed better than standard care alone, and remdesivir, which is an antiviral drug. Earlier in the outbreak, an ethics committee in the DRC approved the 4 experimental treatments for compassionate use, and patients at all the country's Ebola treatment centers have had access to them, along with safety monitoring. However, the formal clinical trial has been underway since November at 4 treatment centers with the help of the Alliance for International Medical Action, the International Medical Corps, and Doctors Without Borders. At a media telebriefing on Monday, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said Regeneron was the drug that crossed the efficacy threshold, triggering a pause in the study. And he said that the group recommended proceeding with MAB-114 because there were only small differences in the data between the 2 drugs. He said the findings of the study are a ringing endorsement that ethical and scientifically sound research can be conducted in an outbreak setting. Then Jean-Jacques Mayombe Tamfum, PhD, he's an Ebola expert who was recently appointed to head a group that is now leading the DRC's Ebola response, said he was grateful for the support of international partners who are working on an extremely difficult setting. Quote, "We can no longer say that Ebola virus disease is not curable," close quote. And just look at some of the early data details that CIDRAP had spelled out for us. As of August 9, the trial had enrolled 681 patients toward a total of 725. Fauci said mortality for Regeneron was 29% and 34% for MAB-114. However, mortality was somewhat higher for ZMapp, 49%, and remdesivir at 53%. He said the results were even more impressive in patients who had low viral loads, 6% for Regeneron, 11% for MAB-114, and so on and so forth. Fauci cautioned that the data are preliminary. He said the numbers could change, but that the 2 of the drugs are clearly better. He estimated that about 15% of the study participants had been vaccinated, and that about 59% of them were found to have low viral load. Anyway, so pretty exciting news, and that was really kind of made a lot of the headlines earlier in the week concerning Ebola. So we'll be keeping an eye on these studies and the work that they're going to be doing with these 2 drugs in the future. Now, in this piece from Stat News by Helen Branswell, I just wanted to point out some very important things concerning the excitement over the drug and all that, and it kind of puts things in perspective. And it says, by some measures, the world has at last reached a tipping point in the decades-long fight against Ebola, one of the most treacherous infections known to mankind. An experimental vaccine is believed to be effective, and this week came word that 1 and perhaps even 2 drugs appear to be appear to significantly reduce the fatality rate among treated patients. But to declare victory against the virus would be to overlook fundamental truths about outbreaks. In some circumstances at least, and the current long-running outbreak is one, Ebola will not be vanquished by vaccines and drugs alone. Well said. Quote, I think the news today is fantastic. It gives us a tool in our toolbox against Ebola, but it doesn't in itself stop Ebola, said Dr. Mike Ryan, who runs the World Health Organization's Health Emergencies Program. He was telling that to reporters, sounding somewhat subdued, as health officials announced for the first time a clinical trial has shown an Ebola treatment was helping people survive the virus. He added, what will stop Ebola is good surveillance, good infection prevention and control, good community engagement, excellent vaccination, and the use of these therapeutics is the most effective way possible in safe and humane Ebola treatment units. It's not one answer, it's many things. Close quote. So I think that's really important to keep in mind with all the excitement of this news, that it is not the panacea for eliminating the Ebola outbreaks and the like. So I thought that was well said. And to close out today's this program, I just want to, then it gets, we've heard some not so good news out of South Kivu, some pretty good news concerning the drugs, and then of course this happens during any large Ebola outbreak, and the number of children orphaned or left unaccompanied by Ebola in the DRC is rising fast. Very sad news, and this is from UNICEF. And they say that the number of children in the DRC who have been orphaned or left unaccompanied due to the Ebola epidemic has more than doubled since April, requiring a rapid ramp-up of specialized care in the Ebola-hit provinces of Ituri and North Kivu. UNICEF and partners have registered 1,380 orphans, meaning children who have lost one or both parents to Ebola, since the start of the outbreak just over a year ago. In the same period, 2,469 children have been separated from their parents or caregivers, either left alone while adults undergo screening and treatment, or isolated because they've been in contact with someone infected. Quote, this disease has been especially harrowing for children, says Pierre Ferry. He's UNICEF's head of children protection programs at the DRC. Children are watching parents die in front of them or seeing loved ones taken to Ebola treatment centers, uncertain of when or if they will return. They are struggling with grief and anxiety while having to comfort and care for younger siblings. Many face discrimination, stigma, and isolation. UNICEF is working closely with partners to identify these children and address their extensive physical, psychological, and social needs. And anyway, so yeah, some really sad news that we see that come out of these outbreaks, especially the larger ones, that there are these children that do lose their parents and family and like, so say a prayer for them. And that's it. That's the update for this week. It was a lot of news that came out on Ebola this week, good, bad, and otherwise. So I just wanted to share that with you. Share the video with your friends. Don't forget to subscribe and check out the website, outbreaknewstoday.com, and I'll see you next time.